Inner Voice, a heartfelt chat with Dr. Foojan.
Welcome to the Inner Voice, a heartfelt chat podcast. I'm your host, Dr. Foojan Zeine. I'm a psychotherapist and author and the creator of the Awareness Integration Theory. So thrilled to have you join us today. I promise you this is really an enticing and insightful discussion where many of you might be needing this discussion because you might be going through it. In this episode, I chat with Dr.Brian, Licuanan. He's the author, speaker, and the board-certified psychologist practicing in Southern California. He specializes in insomnia and family crisis interventions, as well as extensive experience working with highly acute clients struggling with substance abuse disorder and mental health conditions. Doctor is passionate about educating the public on mental health and substance addiction, and he has appeared on CBS, the Doctor's Show on CBS, Dr. Drew Midday Live, and Good Day LA, along with several podcasts, and has authored several articles. Today, we're going to be talking about his latest book, How to Get Your Resisting Loved One into Treatment, a step-by-step guide for mental health and or addiction crisis. It's a strategy guide to help family members with loved ones refusing help or treatment. And we talk about how to get the family ready, define some of the conversations that people might have, what tough love is, how to be respectful when you talk, how to come and bring everybody together in a sense of the family members and know each one what the roles are. I'm positive you'll enjoy the conversation as much as I did. Now, sure to subscribe to also this podcast and my YouTube channel and connect with me through my website, foojanzeine.com, or any of my social media platforms. Go to Apple Store or Google Play and download Foojan app, where it has all 6 phases of the awareness integration in there for you. You can have 31 areas of life, and you can go through each one and really see what's stopping you and what's holding you back in your success, and really give you a step-by-step ways of succeeding and setting up your goals and clearing your past on any obstacle that you have. So go to Foojan app. We have found that people gained improvement in those areas of life between 60 to 70%. So I'm positive you will enjoy it. Now share your thoughts with me. I love to hear from you. Now, without further ado, here's Dr. Brian.
Listen up if you want to promote your personal growth and self-awareness. I found the Foojan app last month and I have been absolutely loving it. I personally have never learned guided meditation, but thanks to this app, I now have learned incredible tools for my own stress relief and emotional self-awareness. Not to mention, there are self-evaluation tools and professional coaching available to utilize however your journey to self-discovery takes you. Join Foojan today and redefine your life one step at a time.
Do you wish to wake up one day and hit the Life Reset button? Life Reset, the awareness integration path to create the life you want by Dr. Foojan Zeine, helps you navigate crucial life areas, heal the past traumas, and cultivate fulfilling relationships and careers. Life Reset is your guide to a profound journey to reshape your life. Grab your copy on Amazon or Audible now and embark on a path to a more joyous and fulfilled life.
Well, it is a joy to have you on our show, Dr. Brian Licuanan. Thank you for taking the time to be with us.
Thank you, Dr. Foojan. It's nice to be here. Good to have a great conversation.
You have a book out, which is so dear to my heart, because obviously I've been also, a therapist and working with addiction for 33 years. And I had my own outpatient program for a long time. So this is one of the hardest parts. And everybody's suspense. What are we talking about? Yes, I'm talking about how to get your resisting loved one into treatment. This is the book, what the book is about. This is the name of the book. And I think so many people suffer from this because they know that there's something going on with a loved one. They, a lot of times, are in denial of themselves. At one point, they see this can't work anymore, but they're going to constantly face different concepts, whether it's the bargaining or the denial, or a person just saying, I'm in control, I could do it, just give me time. And some people give up. Some people don't know how to push. So I think this is so much needed. So first of all, thank you for writing this book.
Thank you. Thank you. It was go ahead.
Now, what got you to write the book?
That's what I was going to mention as well. That's usually the follow-up question to the book is how or where did it come about? And it's a very, very good question. And where it came about is, if I could say a little bit about what I do clinically, because that would give you an idea of what I do. And so for almost 15 years, I was working at a treatment facility for adults that were struggling with mental health, psychiatric conditions, and some type of substance use disorder. Typically, some of them were primarily mental health, but many of them presented at this residential treatment facility with also a substance use disorder. And a lot of these clients were high-level acuity, a wide range of psychiatric conditions, such as, of course, depression, anxiety, along with post-traumatic stress disorder, maybe bipolarity, or one of the schizophrenias, such as schizoaffective disorder and so forth. And so that was one of the work places where I really worked intimately with, whether it be the family, the individual. Also as well, through the National Alliance of Mental Illness, I worked with a lot of, still today, for almost 15 years, work with families who have loved ones struggling and in crisis with either mental health and or a substance use issue, and different various media and giving talks to whether churches or organizations. And where the book came about were these very thematic inquiries or challenges that these families were enduring. And over time, questions such as, what do we do because our loved one is also suicidal? Or how do we set boundaries if they threaten never to talk to us again? Or the family dynamics are so fractured, we're not sure if we can help them at all. And then so those questions were very thematic, along with my interventions and recommendations. And so after a while, it became very formulaic in my interactions, no matter with the families in residential, to the NAMI group, to talking to a church. And so I decided to put that down in some type of manual that people could resort to and to use as a reference, because I initially thought there's got to be something out there already. You know, I'm not this pioneer to anything. And so, but I realized that there are a lot of different things, but there's not an actual manual that talks about steps to get your resisting loved one to a place of accepting help. And so that's where that came about, was a collection of experiences and clinical work, and from basically what I believe was a gap in the community.
Yes, absolutely. One of the things that I noticed, it really depends on what the age of the person who is dealing with addiction is, and then also whether the family is also suffering with some sort of addiction, or they have some idea about addiction, or they've been in treatment or not. Many group of the families that I work with, if the family does have some sort of an addiction, but their addiction has been more functional addiction, so they don't really recognize when someone comes in and now is going, their addiction becomes non-functional. And because of this, they either, and depending on the age range, whether they're a teenager or a young adult or someone who is much older, there's a lot of confusion about what to do, how to approach them. Should I become, have a tough love with them, or should I just go through and be nice to them? And they get so confused based on all of the messages that they get, because the tough love sometimes backfires, and then they feel guilty because now their loved one has to be living on the street, or go through getting robbed or prostitution or death. and then they feel very guilty. And because of they catastrophize it that way at the beginning, and they're like, no, we won't do it. And so we're not going to tell them to leave the house. But then they go through the suffering, and then the shame and the blame is consistently there. And it destroys the whole family inside out, actually.
Exactly. And you brought up a very good statement or words that are out there. And a lot of what I did also in my book was to clarify terminologies out there that are well-meaning, but what happens is that people take it beyond what it's meaning, or they frame it in a way that actually becomes counterproductive and dysfunctional. And one of them words, it was tough love. And I talk about that a lot in what I call my 25 must knows, which are I believe the essential foundational knowledge that people should know in terms of helping their loved one get to a place of needing help. But tough love is one of those. And in a lot of my groups, people say like, wow, we have to use tough love. And what happens is they conceptualize tough love as this very absolute, cold, draconian type of love that we're done with you. We don't want anything to do with you. You get help before we ever welcome you back home. And one thing I tell families, that's very dangerous for a family member who's lost, helpless, hopeless, maybe even psychotic. And that puts them in a place where they're going to give up hope. And sometimes that can end tragically. And so what I reconceptualize to family members is tough love to them when they're coming from that type of very harsh way can also mean tough luck. And I call it assertive love. And assertive love is this nice balance between having rules and relationship as this intimate bond, but yet there's boundaries. And I truly believe across the board, whether it be with a parent and a child, a spouse to a spouse, a coworker to coworker, a manager to an employee, and so forth, is the best productive and functional relationships is when there's a nice balance between having rules and relationship. When you're too much one or the other, if you're too much rules, that breeds rebellion. When you're too much relationship, that can breed contempt. And so that's what I tell family members we're not telling them you can't live here any longer. We're not telling them we're not going to support you. We're just telling you, being very clear of what we're going to support, not support. We are no longer going to support this lifestyle of substance use or you refusing any help, but you're more than welcome to have our support if you are willing to make those necessary changes, because we're doing more harm than good and perpetuating your unhealthiness when we continue to engage in this unhealthy path or lifestyle.
Yes, I call it a lot more of a respect, because the respect tone of voice, the words that are being used, they're offering the love and support with a lot of respect, but as you said, with full on boundaries that are there. And then that allows the person who is struggling at that moment to know that they are valued, and that they're loved and they are valued, but their behavior is no longer suitable for them or anyone around them. And also, because when someone is struggling from addiction, they become very self-centered at that moment. They're not necessarily looking externally and the impact that they have on other people at all. They kind of justify their impact on themselves. They're not really taking responsibility. So at that moment, they don't have the ability to see. And I think it's the parents, or like you said, anyone around, that also can share with them what the impact is, but without the blaming concept of it. So this is the impact that's having on the rest of us. And I think that's part of sometimes when interventions are done. Are you in the favor of interventions also in that approach?
Well, an intervention, depending on what that intervention entails. And so we have the intervention out there that we typically know. It's when we focus on the loved one struggling, we get all the other family members and pretty assertively say that, hey, we love you, we care about you, you need to get some help. And so that is very needed, I believe, when the circumstances and everything is appropriate. What my book was based on was not the intervention on the individual themselves, but as an intervention on the family. And as you know, working in treatment, that you can send a loved one to treatment. They could be there for 3 months, 6 months, a year, 2 years. But if they're going back to that same family dynamic, their probability of long-term success greatly diminishes, is because that if they enter there and they're not growing, they didn't adapt, they don't understand their part and role and responsibility, sooner or later, even if that person has a very strong recovery program, it will weaken if they are going into a family predominantly that, of course, hasn't evolved or changed. And so my book is geared towards actually the family unit on what interventions and what their role responsibilities, what education they need, what they need to do. And there's a saying that I have, let's say you have a family of 5, and I like to use a lot of metaphors, and one of them is on a rowboat, right? To maximize speed and distance, everyone has to work 100% on their share. 5 people in a rowboat, they have to assume 20% responsibility, but they have to work 100%. Does that mean everyone is equal in their knowledge, their stamina, their athleticism? No, but they have to recognize their part and work 100%. And same with the family unit. The intervention is, there's a saying in recovery, you didn't cause it, you can't cure it, you can't control it, the 3 C's, but you've perpetuated in some form or fashion, whether it be the overloving father, the mother with communication issues, the sibling who's disengaged, the other person who is overindulging, is everyone's contributed and they have to recognize that part. So that's where an intervention is the one that I focus on. But yes, I do believe interventions in the most part are important. It depends on the appropriate needs and how we approach and what the strategy is for that.
So one element that you also talk about in your book is for the family to first learn about addiction and understand the dynamic of the disease first before they take on a conversation. Can you share a little bit about that?
Yeah, the word, again, a big word, disease. And don't know if your listeners are aware, there is not one unifying definition of disease. The World Health Organization, the American Medical Society, the American Psychiatric Society, even in the American Psychological Association, there's no one unifying definition of a disease. Some of the common definitions are some entity that has some symptoms, right, that causes impairment in one's life. And so there's psychiatric diseases, there's medical diseases. What I like to do for everyone to be on some unifying spectrum of understanding is a disease is any entity that's been chronic that causes impairment in several areas of our life. And so when we always think of a disease, we always think of some type of medical or even a psychiatric or substance use disorder. But things like selfishness, right? There's no diagnosis for selfishness, correct? But if that causes problems in your life, that's your version of a disease. Racism, right? There's not a medical or psychiatric diagnosis of racism, right? But if that causes problems in your life, that's your version of disease. In the Alcoholics Anonymous, in the anonymous community, they call disease is not at ease, dis-ease. And so my point being that I communicate with people is that we all have our own version of disease when it's defined that way. And therefore, we're all in some version of recovery, which is an intentional plan in place for healthier living. And so that's why when I was speaking to the intervention of the family, everyone in that family unit has their own version of disease, whether it be early trauma that they didn't resolve, that difficulty parenting, from someone that grew up in a culture where mental health is looked down upon, that's a sign of weakness, to someone with substance use issues, they grew up that alcohol was a normal thing and normalizing it and minimizing it. So that's how I communicate with families regarding the disease. And that's where I help them understand is the family disease and their own individual disease, along with their loved one's struggling disease.
Yes. And I think that the understanding of it is very important, because I think what my experience has been a lot with families who have not, even with families which one of the parent that does have addiction, still when it comes to their young children or like, let's say, young adult who is suffering at this point, the experience internally is different than when they are a parent and they are trying to do this externally. It's very fascinating to see how the role of a parent or the role of a sibling changes when they're working with a family member, or whether they're also going through this themselves. Because treatment and I think dealing with addiction is different also for each person. Also, although I do agree that this is a disease because it across the world, in any culture that you see, the symptomology is very similar, although the dynamic is different, or
Yes.
based on whether there's a use of chemical or there's a particular behavior, that the ramifications and the consequences are different. But the internal process of addiction is very similar in all. I consider myself an addict, and my brain works like an addict. I started with cigarette smoking, and then it turned to food. So I have the idea, I can see how I lie to myself and I manipulate myself. And, one part of me rationalizes while, the other hand is already putting a cigarette in. It's like split, the parts are split. But then the dealing with the self is so different than when you're dealing with another loved one, and you're trying not sometimes to project what's happening inside of you and how you're dealing with it onto the other person, and maybe the other person is dealing it very, very differently. So let's start with, how do you approach? One of the things that you have in your book is, first, like, let's identify the problem and its severity. Can you share about that?
Yeah, because a lot of times families, they have an idea, and what you're referring to are these 12 steps that I outline on family members to strategize to get their loved one to a point of hopefully accepting help. But a lot of times what's really important is operationally defining terms. For example, if I have a therapy group, there's 10 clients in there or 10 family members. I guarantee if I ask them each to define depression, I guarantee you're going to get probably 10 different definitions, maybe some similarities, or even substance addiction, right? And my point being is, we have to operationally define terms so we're on the same page. And it's so variable in how we do that, and based on life experiences or education or just their preconceived thoughts. And so first you have to identify the problem. What is the actual problem? Because that can open the door to a lot of things. We tend to focus on the person usually causing the most harm. So obviously, let's say you have a male client, son, who is struggling legally with legal issues and has this uncontrolled substance addiction. So all the focus becomes on them. But we forget about there's other maybe inherent problems within the family. Well, but we tend to correlate, that I find, is the degree of pain and suffering someone's causing is the degree of change that needs to take place. Yes, of course, they need to revise and make some changes in their life, but we also have to identify that there's other problems. There's probably a codependent or enabling family. There's dynamics there. So that's what I believe is the most critical thing to start off with, is what is the problem or the problems, and how severe is it? So.
Yes, and then you share about how to foresee after the problem what can be changed, right? Like accepting what is it that needs to be changed. One of the questions that showed up for me as looking over your book is, when you're working with the family, and then I think it's like the establishing of coalition, as you say, is how to bring the different groups of, like, how to bring the parents or the siblings or even, possibly friends who are constantly there, or how to bring all of these people to, like you said, to take responsibility for their 20%, and then to collaborate in whatever change it is that that is agreed upon, let's say.
So your question is how to do that, or... Yeah. And so if I can upfront that, is that, as you know, and these are great questions, by the way, these are wonderful questions that you're talking about with my book, probably one of the most detailed. So I really appreciate that. And so there's a support system. And I talk about that there is the coalition, there's a primary and secondary support system. And so what I like to look at is like a fleet of boats in the water. And so the coalition are those people who are, especially in the initial phases of this process, that are on this boat. Let's say there's 5 people on the boat. That could be parents, siblings, spouse. And those are the most critical people. Usually those are the people that have the most influence and impact and most intimately involved. And those are the people, the decision makers, and those are the people that are going to seek and have a unified vision and aren't going to waver from the underlying strategy and the goal. And then you have a primary support system, and those are people that are intimate with the loved one, but these people might not be in that coalition, in that boat. These might be cousins or siblings or relatives and friends. And then you have a secondary support system, which could be friends and coworkers. And so my point being is that they're all important, but sometimes we just believe that just because you are in the support system, we just throw them in there, right? And then all of a sudden there's too many hands in the kitchen, and it just breaks into fractures in the relationships and a unified vision. And so that's what's really important, is to vetting who are those people in that primary support system, because a lot of times family members assume, well, yes, you're the parent, you should be in here, but we forget that maybe this parent isn't at an appropriate place at this moment in time because they're having their own struggles, or maybe even the spouse is struggling. And so that's why it's very important for that step to really vet and be conscientious of who's going to be those people in the initial phases of this process, what I call phase one, which is usually the first 30 to 90 days. And slowly we'll integrate those other people. And so I'm glad you bring that up, because like I said, just because they're a family member doesn't mean that they are going to be intimately involved and effective throughout the whole stages of the process. That can actually do more damage than good when that's not looked at carefully.
And you're talking about the parent, the family who are dealing with the person who's also struggling. So throughout the time that we're getting ready, the family's getting ready, they're still having a dynamic conversations or relationship. So it's not like, they're going to get ready at one point and then have these conversations. I think the conversations are happening systematically where it's a process that gets to. So it's important. I think it's so important how you've shared this, which is the person needs to know, the family need to know that what the disease is about, what the condition is about, what is the condition of this person who has that might be different than someone else who's there and partially could be addicted and not, very functional addicts. And then, or what is the meaning and how they identify, their own relationship and how they identify what the problem or the need for changes. And this really takes a lot of also dialogue in between the family system, and to create that type of safety for them to be able to have this. Because, a lot of times when this happens, if there's a child of the family, they blame each other, like parents start blaming each other, or the other siblings blame the parents, or the parents blame the siblings of, how come you didn't tell me before? So it's very important to have the ability to have this kind of a safe environment for each one of them to be able to share what's going on for them. How do they see this, and then how to collaborate and come to a place where each one of them can take on the role that they want as a support to their loved one who needs to go to treatment, and how to bring that to them. Can you also share when all of this happens and there's a resistance? And I know this is a very broad question, but if there's a resistance that is happening at that moment overall, because I think sometimes people feel like, okay, we're all failing at this time. And what is your approach to kind of continue this process and not go into kind of a self-blame and then dissipate versus, yes, there's an obstacle. Obviously, the disease itself is a way, it pushes back the treatment. So this pushing back is still part of the process. How do you share with the family that, let's kind of like hang in there?
So if I could clarify, is it resistance towards the loved one struggling, or is it resistance from the family, or all of the above?
The resistance from the loved one to go into treatment, although the family is doing this, because that's the whole concept.
Okay, got it.
Getting them ready, and then they go, and usually, I've rarely had the experience of this past 30 years that if everybody's coming and then suddenly the person says, okay, when they go, there's some back and forthness there. So I'm sharing with you. Can you share when this kind of
Sure.
continues, that the family members don't get discouraged and say, we tried, it didn't work?
Yeah. And you highlight different points. As you were asking that question, all these things were coming into my mind. And so one of the biggest things that I mentioned earlier is, well, there's that 3 C's: the family or no one caused it, can't cure it, you can't control it, but you've perpetuated it. But there's a lot of upfront knowledge that's really critical for the families to understand and know. And one of the biggest barriers to why family members are struggling to get their loved one help or set boundaries and limits or put them in a position of desperation, that I call it, to get help, is guilt and fear. I look at the disease as this very rundown car, and its oil and gas is guilt and fear. If I could narrow down, and of course there's other obstacles and barriers to getting help, like shame and guilt are definitely very, very powerful ones. But guilt and fear, fear, of course, my loved one dying, my loved one being trafficked, my loved one never speaking to us again. And then there's also guilt that we weren't there for you, or I struggled during your childhood, or I had that divorce early on, or I brought in that step parent too soon. And those is what the disease loves. It thrives when I personify this disease with guilt and fear. But one thing I like to tell families too is like I said, what I mentioned earlier, is we're not forcing them to do anything. We're not telling them get treatment. What we're telling them, or that we're not telling them you can't drink anymore, you can't use anymore. Because as you know, in the human condition, when we tell people what they can and cannot do, what do? We resist, right? And we've seen that in the past 4 years for sure. What happens when you tell people what they can and cannot do? What you're doing is you're giving them that options. You got to communicate very clearly to your loved one by identifying leverages, is that we're not going to support this lifestyle, whether it be they can live here, we're supporting them financially. And so what I tell those family members also as well, to help them get through this resistance part when they recognize what they can and cannot control. But there's 3 inevitable consequences to untreated mental health or addiction, right? Especially when it's a high level and acute level, is your loved one will eventually end up in jail, institutionalized, or they can lose their life, right? And I say that homelessness is temporary, but eventually untreated, and they stay at a high level of acuity, they'll end up in jail, hospital, or they lose their life. And so that last one of losing their life is a biggest fear and barrier with a lot of parents, because I'm a parent myself, and outliving your child is the biggest fear. And that's what keeps family members stunted and stagnant and not taking necessary steps. But when families accept those, and that's what I do, and to answer your question, what do you do with family members, is you recognize what you can and cannot control. And when they're in acceptance of certain things, things become a little bit more clear about what they have control over. You're giving the person option and accepting the inevitable consequences if we don't take action.
Everyone, how to get your resisting loved one into treatment, a step-by-step plan for mental health and or addiction crisis. You also shared about how to, like, a lot of times what happens is, and I've done that myself, where I've had to call 911, and because someone was, I recently had someone where the 19-year-old came back to the family house, and he was at the kitchen. He was completely high on crystal meth, and the father said something, and he, started taking one of the knives and running after the father. So they had to call 911, and then we were conversing. Mm-hmm. And there's a lot that goes on at that moment in the family, when the family needs to call for support out there. Obviously when the police comes, even when there have been times where I've had to call 911 because there was a threat of suicide with one of my clients. And sometimes when the police goes and they know that they're here, there's a weapon there, obviously, they need to protect everybody. Mm-hmm. They do. Sometimes it also, it's harsh. So you share about how to talk when you're mm-hmm. 911 and identify what the issues are. So hopefully we minimize some mm-hmm. of the trauma that might happen. Can you share a little bit about that?
Yeah, that's a very, very important question. And some of the groups I work with is that they had to call the police because of those type of situations. And one thing I'd like to tell your community members is whenever there's a significant threat to your loved one or to others, don't be afraid to call the police. I know that's something we don't want to do, and our minds wander like, oh my God, they're going to have a record, they're going to do something. And don't be afraid to call 911 if your loved one is in imminent danger of harming themselves or others, is because sometimes that some of the places that they can end up are the best places, whether it be getting a legal case against them or going to a hospital. But don't be afraid. But if you are in that situation, one thing that's wonderful that I see increasingly law enforcement are getting more mental health education. There's actually programs for that, is because they're recognizing a lot of these calls that they go on, domestic, are mental health related, either an untreated mental health condition or a substance related one. And so they educate people that the type of call you make can make a difference in how the response is. And if, for example, that person, if you're just going to say, the father calls, my son is running around, is trying to kill me with a knife, right? That's going to be a very, very intense call. That's a violent domestic abuse, and the police are, you got to remember, they're afraid for their own lives too. They want to get home safely as well to their loved ones. And so they may approach it in a different way. However, if you make a call that, hi, I'm here, I'm worried that my son has an untreated mental health conditions and other abuse of substances, and he's in imminent danger of harming himself or others. And so that might be a different response. And he's armed. Okay. And so the fact that he's armed, it puts a little bit different equation, but what's going to happen is they're going to probably alert a psychiatric unit to come and assess. And let's assume that this particular case, there wasn't a weapon, that this person is just screaming and yelling and tossing over tables, but not harming anyone, but has an untreated mental health condition. They will respond very differently and assess it very differently. So that's what I encourage parents is to be educated in that as well. And so that's why that was a very important part. And I'm glad you highlight that.
Beautiful. In 1 minute or so, is there anything we haven't shared with people that you really, really want people to know?
Well, one of the things in my must know, the first thing I say is have hope. And it's the very first thing, is this hope, that belief that something can change. What's really important, because I've seen and worked with the most difficult cases where someone's psychotic or long-term substance use or suicidal, and they're able to get on track. And what it's really important is for the family members is to recognize they still have power to make changes, is because the reality is, if your loved one's been struggling a long time, it's on some level because they can, some form or fashion, the family unit has perpetuated or enabled it. It's not to point blame or fingers, but it's willing to reset and recognize that there's still things we can do. And so really, really have hope. And for loved ones out there struggling themselves, there is still hope, plenty of hope for you. It's just this willingness to make change in belief that there is a process out there that is there to help and get us on the right track.
Where could people find you?
People can find me, best way is on my website, Dr.Brian.Licuanan.com. I'm assuming you're going to probably put that in the description, but that's a little bit of my services, a little bit of my book, my excerpt, and then a lot of my media appearances are on there. And then Instagram at Dr. Licuanan, and TikTok at Dr. Licuanan, and YouTube as well at Dr. Brian Licuanan.
Beautiful. Thank you so much for taking the time to be with us.
Thank you so much, and great work that you're doing as well. Thank you.
And for all of you who are out there, create an amazing life for yourself and everyone around you. And until next week, bye-bye.
Are you a psychotherapist looking to enhance your practice? The Awareness Integration Therapy, developed by Dr. Foojan Zeine, is a comprehensive guide to the principle and techniques of this powerful therapeutic approach. Join the growing community who have elevated their practice and expanded their skills by embracing Awareness Integration Therapy and witnessing its life-changing impact. Order your copy on Amazon now.